As a recommendation from the coroner, it was decided that the air ambulances in Victoria would carry blood with them. The coroner's finding was in relation to a lady who was transported from a rural area in Victoria en route to the hospital. She actually passed away, and it was believed if she would have been transfused en route, so if the ambulance would have been carrying blood, her outcome would have been quite different. She probably would have survived. So that was the recommendation from the coroner, that blood be carried in ambulances just in case. So that these sort of conditions where people were exsanguinating. Exsanguinating means they were bleeding to death. The project started in last year, in January 2011. The first hospital that came on board to provide the blood to the Air Ambulance Victoria was the Royal Melbourne. And after that, 4 other hospitals came on board. And then in June of 2011, Bendigo Health decided that they would supply the blood to Air Ambulance Victoria here in Bendigo, so the Air Ambulance base here in Bendigo. It was a collaboration between Bendigo Health, Air Ambulance Victoria and the Australian Red Cross Blood Service. What we had to do in the first instance was to make sure that when the blood left here, that it was stored at the right temperature. It's essential that blood is stored at a specific temperature so that it doesn't become unviable. Okay. And so we had to make sure that the transport eskies that we used and the refrigeration at the Air Ambulance Victoria base here at the Bendigo Airport was all legitimate. So it had to be validated, alarmed and monitored, and that Bendigo Health could receive the recordings of the temperatures that the product was stored at. The good thing that we did was actually investigate thoroughly prior to the implementation. So we used different temperature dots on the bags, so the bags of blood. So if they go higher than the correct temperature, they change colour. So we had that extensively investigated prior to the implementation. We also had the validation of the special eskies they use. And so all of the validation was done before we actually came on board. And since then we've had, it's worked extremely well. We get the recordings from Air Ambulance Victoria of the temperature logs, so that's the validation of the temperature that the blood's been stored at, and we get that on a weekly basis. And so because we did all the groundwork before, it's all going quite seamlessly, and it's quite surprising that it's caused us so little angst. Blood is such a valuable resource, and if the blood isn't used, so the Air Ambulance keep the 4 units. If they don't use them, they're returned to the pathology department. They're given another 4 units, and as long as the blood that we've had returned to us has been stored at the correct temperature, we can actually reissue it to other patients throughout the hospital. At the Bendigo HIM, so the Helicopter Emergency Medical Service, they've actually used it 4 times. And on 2 of those we've had very successful outcomes. One girl survived and came back and is living like a normal life now. And certainly she had a lot of blood loss, both at the accident scene and en route. So the emergency O-negative blood was used on her extremely successfully. It's a great feeling to know that it has made a difference. In giving blood, we give a lot of blood through the hospital, and I see how amazing it is to see someone who is so flat and so unwell and have a transfusion of blood, and basically their life comes back into them. So even though I don't see that in the ambulance, so the air ambulance, I can well appreciate what the blood has done. It's a gift of life.